Welcome to The Explainer. Today we're breaking down the brand new 2025 guidelines from the All India Difficult Airway Association. We're going to look at their new game plan for one of the most intense situations in all of medicine, securing an airway when the clock is ticking and everything else has failed.
So let's just dive right in with the crisis itself, the unanticipated difficult airway. This is that moment every anesthesiologist dreads, where all the standard procedures just aren't working, and every single second becomes critical for the patient's survival.
And this is the nightmare scenario. You see, once you can't secure an airway, the patient's oxygen levels can just plummet. It's this terrifyingly fast spiral from not being able to ventilate to not being able to oxygenate, and that can lead to hypoxia, brain injury, and, well, death.
Right. That is the billion-dollar question. And this is where the new 2025 guidelines come in. They've laid out a super clear-cut plan of action that's all about intervening earlier and with a whole lot more confidence.
Okay, so let's get into the specifics. What exactly happens when Plan A and Plan B and Plan C all fail? You know, when the tracheal tube, the supraglottic airway, and the face mask just aren't working.
Now here's where things get really interesting. Take a look at this new algorithm. It's not some rigid step-by-step checklist. No, it's actually a dynamic, circular approach to rescuing the airway. It's a whole new way of thinking.
And this slide really shows you that shift in action. First thing you do, call for help. Activate code D. Then the team can try to ventilate using any of those three main devices. And here's the key. They can switch between them as needed. There's no strict order. Whatever works, works.
But, and this is a huge but, the guidelines put a hard stop on it. A maximum of three. 3 total failed attempts across all those devices. The second that third attempt fails, a massive decision has to be made. And you have to make it even if the patient's oxygen levels still look okay.
And that decision brings us to the biggest, most significant change in these 2025 guidelines. A totally new and much, much earlier trigger for moving to a surgical airway.
They've given it a very precise name: complete ventilation failure. This is the signal. It's the moment you realize that none of the standard methods can get air into the lungs. And it doesn't matter what the oxygen monitor is showing you in that moment. Ventilation has failed, period.
This is a really fundamental shift in thinking. The old way was reactive. We waited for the cannot intubate, cannot oxygenate scenario, which basically means you're waiting for the oxygen levels to drop. But the new trigger? It's proactive. You act the second ventilation fails so you can prevent that whole crisis before it even begins.
So once complete ventilation failure has been declared, the team moves straight to an emergency cricothyroidotomy. And the guidelines are very specific. They recommend one particular procedure.
It's called the stab, twist, bougie tube technique. And what's so brilliant about it is the equipment. It just uses these 3 items: a scalpel, a bougie, and a regular tracheal tube. Things that you can find in pretty much any medical setting, even places with limited resources.
All right, let's walk through the 6 steps of this thing. The whole point is that it's designed to be a really simple, memorable sequence, which is exactly what you need when the pressure is on.
So it starts with one single, confident, horizontal stab through the cricothyroid membrane in the neck. Then, immediately, the blade is twisted 90 degrees. That single motion creates the opening and holds it open.
Okay, the airway is open. Now you have to secure a pathway, right? So the bougie, which is basically a flexible guide, is slid in right alongside the blade down into the trachea. Then the knife comes out carefully, leaving that bougie behind as your guide wire.
And now for the final part, the cuffed breathing tube is just slid or railroaded right over that bougie and into the trachea. Once it's in, the bougie is pulled out, the little cuff on the tube gets inflated, and that's it. The airway is secure. You can start ventilating immediately.
This whole sequence is so simple and memorable. And that's the point. It's designed to be easy to learn and, most importantly, easy to get right when a patient's life is literally on the line.
So why is it so important to standardize on this one specific procedure? Why does that matter so much for patient safety?
Well, it really all comes down to cutting out hesitation and boosting the chance of success. The guidelines themselves point out that this technique just works better and faster, even for doctors who haven't done it 100 times. By recommending one single proven technique, you take all the guesswork out of a crisis.
So what this structured approach really does is pretty amazing. It takes what could be a chaotic, absolutely terrifying event, and it turns it into a clear, manageable, step-by-step emergency plan. It gives the medical team the power to act with confidence. The AAADI 2025 guidelines argue that, yeah, it can. In fact, when you're faced with a failed airway, a clear plan isn't just helpful, it's everything. It's the thing that has to make the difference.